Now we're going to identify some arteries. Now we're going to identify arteries of the brain, and we're going to look at two different types, an MRA using MRI imaging with contrast, and angiography, which is the gold standard, which uses ionizing radiation and contrast. Here are the arteries that we're going to identify, but let's first find them on diagrams. Let's start with orientation. Once people look at the arteries, they get a little confused at the direction. So in MRA, you're going to see all of these vessels. It's going to be from the head up. We're going to see the two vertebrals back here becoming the basilar. We're going to also see this internal carotid artery doing a wiggly way up, and it's going to perfuse primarily the middle and anterior cerebral arteries. So let's look at this region. Underneath the brain, I want you to see that these two holes here, they're the cut off portion of the internal carotid artery. So you have an idea of where we're looking at. So we have this internal carotid artery moving up, and then on the posterior side, we have the vertebral arteries coming up to then become the basilar. So hopefully this gives you a little more perspective of what regions of the brain we're looking at with these vessels. So now looking at the internal carotid artery and the basilar, this is where we see the internal carotid artery. We can see this lateral view matching the position of the diagram and the basilar here. So you can see that they are separate from each other. This MRA image shows the vessels all together. And this is early on when the contrast has just arrived. We see it's just arrived going up the basilar, and it is also now in this posterior cerebral artery as it goes to the back side of the head. Here we're going to the middle cerebral here, as well as the anterior cerebral goes forward and whooshes up and over. Here we can see the diagram on the left, and then we can again see the image on the right. We have our internal carotid, we have our basilar. Now this is a view looking straight on as if the patient's looking out the screen at you. We have our basilar artery located here just anterior to the pons. And then we have the two internal carotids. When the brain is removed, you have to cut the internal carotids off. So where they would be are the dotted lines, and that little whole circle there represents the cut point of where the end of the internal carotid is located. So let's look at the MRA where we can see the lateral view on the left and an anterior oriented view on the right. Let's identify these vessels. We see the internal carotid arteries as they ascend. Then we have the vertebral arteries on the posterior aspect going through the cervical vertebrae. They become the basilar that's going to be just in front of the pons. That then goes out to the posterior cerebral artery. Then we have the middle cerebral that's going to go out towards your ears and up. Then we have the anterior cerebral. It's going to go anterior and midline. As it also, we can see from the lateral view here on the left, it will also go forward and begin to move more posteriorly. Now we can see the posterior communicating artery. As it goes back here, we can see it starting to form that circle of Willis that we could see on the right. We have our anterior communicating artery, which is going to connect the two anterior cerebrals there. Now on this anterior view where we have an MRA on the left and we have a standard angiogram on the right, we can see these vessels here where we have the internal carotid in pink. We can see that it goes to the anterior cerebral in blue as it moves to the midline, up, and posterior, but we're not seeing the posterior aspect. We see it going up and crests over from the top of the brain, where the middle cerebral goes lateral towards the ears, and then it will spread out from there. On this lateral view, we can see the internal carotid. It's going to be anterior as it branches out into that anterior cerebral, and then we can see some of the middle cerebral branches. They weren't colored in, but these would be the comparable middle cerebral branches on the left. With the MRA on the left as a standard comparison, on the right we are now showing an angiogram, but in this case the angiogram has the dye is coming in here, which is going to be the vertebral artery coming posterior to then become the basilar. So with the standard angiogram, you're only selecting one vessel to inject the dye in. The MRA on the left, you just have dye circulating through and you're now seeing all of them together. So the standard angiogram here on the right is slightly oblique. We have our basilar coming up, then it moves out to the posterior cerebral going to the back of the brain. We can see this here is the superior cerebellar going to the top of the cerebellum. We have our anterior inferior cerebellar, also known as ICA. And then we have our posterior inferior cerebellar artery, or pica. Now we can see, comparing on the diagram, again with the basilar artery, posterior cerebral going up to the cerebrum, which the diagram doesn't show. The cerebrum here is the superior cerebellar, anterior inferior cerebellar, posterior inferior cerebellar. And what we didn't mention were pontine, and these are all these tiny little vessels going here onto the pons itself. Now we're going to look at an angiogram where contrast dye is injected, in this case into the internal carotid artery. And we can see as each image sequence progresses that we have the internal carotid artery and it branches to the middle cerebral artery and the anterior cerebral arteries until it perfuses all the way to the much smaller vessels, and then ultimately returns via the venous system. We can see the various venous sinus structures as the dye is now exiting the hip. Here is another angiogram from a lateral view, also with the internal carotid injected. Here's the right vertebral artery from the anterior view, looking face to face with the person. We can see the vertebral artery coming up, moving medially, and now it arrives to the basilar, and then we can see it going out to the posterior cerebral up here. You can see the posterior cerebral and the cerebellar perfusing cerebellum and cerebrum, and then ultimately being washed through the venous sinuses. This is a lateral view also of the vertebral artery. We can see as it goes from the vertebral artery to the basilar, to our superior cerebellar and our posterior cerebral artery. This is an MRA where contrast is injected into a person and an MRI is utilized to capture it, and you're seeing the outline of the blood vessels. So this image is of a person looking out of the screen directly at you. So you're face to face. These are the internal carotids coming up from the neck. These two posteriorly, these smaller ones, are the vertebral arteries, and then they merge together above C1 to become the basilar. Now we'll go through a series while this person is turning their head to the right. And now they are exactly to the side. We are seeing vertebral arteries back here, the internal carotids up here. This is the basilar that will serve the posterior aspect of the brain, and the internal carotids are serving the anterior and more middle regions of the brain.